We will be talking to you about the purpose of clinical laboratory, the models of clinical teaching, and lastly is the preparation of clinical instruction. So what is clinical laboratory? Clinical laboratory in university hospital should be operated in good balance of medical practice, education, research, and management. The role of the clinical laboratory is to promptly provide highly reliable laboratory data to satisfy the needs of the clinicians that is involved in the medical practice and health maintenance of patients. Improvement and maintenance of quality of laboratory staff and environment are essential to achieve this goal. So let's proceed with the purpose of clinical laboratory. We have 7. First is where theory and practice come along. Second is to perfect or master skills. Third is the opportunity to observe. Fourth is to refine problem solving, decision making, and critical thinking. Fifth is to gain organization and time management skills. Sixth is to develop cultural competence. And lastly is to become socialized in the clinical laboratory.
For the models of clinical teaching, we have traditional model, preceptor model, and preceptorship model. For the traditional model, the educator instructs and evaluates small groups of nursing students on site during clinical experience. The advantage is the opportunity to assist students in using the concepts and theories learned in class through readings and other learning activities in patient care. The disadvantages are large number of students for whom faculty members may be responsible and not being accessible to students when needed because of demands of other students in the group. For the preceptor model, the expert nurse in the clinical setting works one-on-one with the students. Its advantages are students can transition into independent practice, develop self-efficacy, improve critical thinking and decision-making skills, and develop clinical competencies. Last, for the preceptorship model, it increases clinical experience for students and expose them to more workplace realities, which should lessen reality shock. Its advantage is it allows students to learn from practitioners with a high skill level while still being guided by faculty. The preparation of clinical instruction. First is clinical agency sites must be chosen. Second, clinical units with the agency must still be identified. Third, there should be enough role models for the learner. Fourth, contracts must be drawn up. Fifth, educators should set up a meeting with the agency staff who will be involved with the education process. And sixth, making a specific arrangement for learners on a weekly or daily basis.
So these are the objectives. After these presentations, students will be able to grasp the use and importance of technology in a clinical laboratory setting, and they would integrate the functions and importance of health education to nursing research, practice education, and to a clinical setting as well. And after the role play, the patient will be able to fully understand the extent of their present conditions, the measures and procedures taken for the interventions, and also establish rapport and trust with the nurse after their interaction.
Let's talk about the evaluation and implication of the Health Education Forum. First, to nursing practice. Education has a significant impact on the knowledge and competencies of the nurse clinician. They become well prepared to meet the demands placed on a daily basis. Technological advancement in healthcare and increased awareness of patients about their rights call for an effective nursing training. Thus, nurses are prized for their skills in critical thinking, case management, and health promotion in all inpatient and outpatient settings. On the other hand, in the aspect of nursing education, health education is a crucial nursing intervention, which is one of the most critical tools school nurses have for teaching health to kids, families, and staff. Nurses must be able to create and conduct appealing and effective programs for students in order to be excellent health educators. They must also learn to evaluate the success of their efforts in order to stress the influence school nursing may have on children's health.
Summarize everything by being exposed to research and incorporating reliable nursing research into health education provides a wide array of knowledge that helps nursing students provide quality patient care.
Good morning, everyone. Let's begin. Nurse, please present the case.
Thank you, Doc. So the patient's name is Mi Auna, 20 years old, and she complains of runny nose. Says she's been here in the clinic for 3 times within a month, and doctors and nurses already gave her medicines for cold, but to no avail. Says she's also tried alternative medicines, but to not avail as well. This is now her 4th visit.
Alright, what do we know about her nasal secretions?
They were watery and clear for the whole 3 times she's been here in the hospital. But a while ago, upon performing nasal lavage, blood was seen in the mucus.
For the whole month, it has always been clear? That's odd. Normally, this would progress into becoming thicker and more opaque or greenish in color. It may mean that there is no presence of infection. Does she complain of headaches, fever, any cardinal signs of cold? Has she been sneezing?
No, Doc, just primarily a runny nose.
Let's come up and run some tests again. WBC count, a chest x-ray, and viral fluid tests. For the meantime, we just perform nasal lavage again to relieve her discomfort. Until then, we can come up with concrete results.
Yes, Doc.
Wait, could this be something in neuro? What about the blood and the secretion? I believe this is not just something a lavage would cause.
She's just having a cold. I heard it's very common now considering how our weather changes frequently. The blood could be due to frequent nose blowing. I can't imagine what a month of non-stop sneezing would do.
If only she's having a cold.
In which she is.
In which she's not. Notice that she was not sneezing upon all of her visits. Her nasal mucus maintained being very watery, and she is not having any headaches or fever, which are the positive symptoms of cold.
How about we'll just wait for the results and we'll
And
figure
what if
out
it is
from there.
urgent? We can't risk anything. They've already sent her home 3 times this month. They don't know what could progress next time if we will send her home again. Nurse, together with those labs, order also a head CT scan and let her stay here and will further monitor.
I can't see why we are all having these efforts just for cold. Not to mention, it'll be a waste of resources for us and our patient if the results from the CD would be normal.
No, I really have a hunch about this. And besides, isn't all this equipment and technology are here for? To render excellent, efficient, and automated services for our patients. What use could their new innovations would be if they continue to be sting about it? This is now our reality, and soon enough, technology will be the forefront of healthcare. And hypothetically, so what if the results come back clean? Then it is a win for both of our sides. And if hypothetically it isn't, then it is a good catch as well, and we'll be helping another patient. We just have to be meticulous right now. We have no room for errors.
Alright, nurse, do what she says.
That's noted, Doc. Alright, ma'am, the doctors ordered for you to have a WBC count or white blood cells count to confirm any signs of infections, a chest x-ray to note any pulmonary secretions that would cause secretions and hence your runny nose, some viral tests so we may identify the cause of your infection as well, and also a head CT.
Okay, nurse, but wait, did you mention about a head CT? Like a head CT scan?
Yes, ma'am, you heard it right. We will be including computers, tomography, and scans for your case. This procedure is painless, quick, and very easy. That is what a doctor advised for your condition.
But I thought this was just a common cold. I mean, I was just experiencing runny nose. It's not that severe.
The doctors have already discussed this matter, ma'am. Given that this has been lasting for quite longer period of time, a computer tomography scan or CT scan will help the doctors to see what is going on inside your body. The combination of a computer and x-rays are used to create pictures of bones, organs, and other tissue.
Will I be okay, nurse?
Surely, I, together with the nurses and doctors, will assist you in every procedure. There is no need for you to worry, ma'am.
Okay, nurse. Thank you. I trust you in this.
Alright, nurse. What do we know now?
So the results for the fluid and viral test, WBC count, and X-ray came back all negative and normal. However, a brain herniation was found in her CT scan.
Would you look at that? Her brain is literally sinking and shifting towards her skull base.
Which means that it is not nasal secretion or mucus. She's leaking spinal fluid from her nose.
Yes, it is definitely not a cold. This is neuro and it is surgical. We'll do a ventriculostomy. We will drain through a hole in the skull to get rid of the
Or we
fluids.
could also combine it with craniectomy. We could remove a part of the skull to make more room so her brain will shift again to its proper position and to relieve the pressure inside.
Yes, definitely. Nurse, book an OR immediately and tell our patient that she will be having a surgery later.
Right away, doc.
See? From a supposed cold up to becoming a brain hernia in just a day. Oh, the wonders of technology, really. It actually enabled us to diagnose it accurately. We are now giving our patient the proper intervention with assurances of improved outcomes. You up, doc? We have all night for this procedure.
Of course. Now let's go scrub in.
Good day, ma'am. How are you?
I cannot say that I am 100% in a good condition, but I am okay.
So this time, ma'am, I will be sharing with you the findings of the different tests you have undergone. The fluid and viral test, WBC count, and X-ray were all negative and normal. But unfortunately, the doctors discovered a brain herniation in your CT results.
What? What do you mean about brain herniation?
Herniation, ma'am, happens when the brain tissues, blood, and cerebrospinal fluid shift from their normal position inside the skull. The secretion you are having is not mucus or nasal secretion. It is a spinal fluid leaking. And so with that, ma'am, we need immediate surgery before the case gets worse.
What? Why didn't the doctors find this out before? I've been going in and out of the hospital for months.
The doctors continued monitoring your case, ma'am. The CT scan has given more details of the reasons behind your condition.
Nurse, you were mentioning the surgery earlier. What kind of surgery is it?
Yes, ma'am. The doctors will perform a ventriculostomy in which they will drain through a hole in your skull to get rid of that leaking fluid. Another is craniotomy, where they will remove a part of your skull to make room for the brain to shift again for proper positions and to relieve the pressure inside.
Nurse, I'm really worried. I didn't know this would happen. Am I going to be alright?
Ma'am, we will be at your side. You are in good hands and we will take care of you.
I do hope that this will be a successful operation, nurse. Thank you so much for guiding me throughout.
Thank you also for trusting us, ma'am.
To summarize, the rise in the number and complexity of accessible tests and services is due to technological advancements, which are projected to continue. Laboratory technology is frequently at the forefront of medical progress. Before effective therapy, testing tools to diagnose or screen for a certain ailment may be available. Testing has become more efficient and automated thanks to developments in laboratory technology, which include both new tests and advances in equipment and testing methodologies. In the delivery of healthcare services, new technology has been linked to enhanced efficiency, fewer errors, and higher quality. But always remember, technology is not replacing healthcare itself. Rather, it is just a means to provide more healthcare.